Thanks for staying with us. Let's get into this now. Omicron has become the dominant variant in South Africa. Scientists are still working on understanding its mutations. What is known that it is highly transmissible and that vaccines offer protection against severe disease. Government now is looking at introducing possible vaccine mandates. It's an issue that has divided the country. To discuss all of this and what we know about Omicron, we are joined by Zola Saphetha from Nehawu, Groome from the NICD, and Professor Shabir Madhi from Wits. Thank you all three so much for joining us. We do appreciate it. Professor Madhi, let's just start with you about the rate of infection that we are seeing at the moment with Omicron. We do know that there isn't much information out yet, but what we can see is that infections are increasing on a daily basis. Is this something to be worried about?
So thanks for having me. So infections are increasing on a daily basis, but in Gauteng we might well be plateauing based on the data over the past 2 weeks. For the rest of the country, unfortunately, they're still at a relatively early stage of this resurgence, and we probably can expect infections to continue increasing in KwaZulu-Natal, in the Western Cape, at least for the next 4 to 6 weeks. But at the same time, I think it's important for us just to be clear that we do expect infections to increase with Omicron because, as we know, it is an antibody evasive variant, and you're going to experience large number of breakthrough cases in individuals that have been vaccinated, as well as reinfections. What's most important is whether we're seeing an increase in hospitalization for COVID-19. And what we're observing in Gauteng is that there's been a complete uncoupling of the high infection rate and hospitalization and the death rate. So the hospitalization rate for COVID, and not coincidental infections, and the death rate from COVID is much more modest than what it has ever been during the course of the previous 3 waves, at a time when similar number of infections were transpiring in the community.
Zola, maybe we can come to you and maybe you can give us a realistic picture of what your members are telling you about what's actually going on. I remember during the 2nd and 3rd wave, there was a massive outcry from nurses and healthcare workers about the situation and how dire it was. What are your members telling you, especially during this 4th wave?
Good afternoon to you and the panelists and the viewers. I must just start by saying as a context that I'm in Durban now. I just traveled between Durban, Beachfront, and Umlazi, drove back. What I noticed is that generally life is normal. People are walking free without masks in town and in the location, and no measures or mechanism put in place. And in such situation, any form of a variant, even if it was not a Omicron, would have increased at this time because everyone else is preparing for holidays and people are on holidays. So that's the first thing. And that happens at the time where South Africa, once again, they lowered their guards because of the complacent syndrome that we have warned the government against in the 2nd wave. And then the 3rd problem that we think that is a contributing factor on the numbers that are coming now is the fact that the dedication and the focus program that was put in place in the 1st and the 2nd wave, particularly at the beginning of this year, February and March, for vaccination, is no longer there, particularly as it relates to the healthcare workers. And now there's a mention about the boosters, which really creates anxiety and a level of reluctance because some people now are starting or beginning to doubt the efficiency of these vaccines to different variants that are coming. So generally, we are bound to have to see many numbers increasing, and also with the message that the government is communicating that the symptoms are mild and not severe. So people in the society that know that is both scientific and biblical, that at one day they will die. So it doesn't matter to them anymore. So life is normal because even government, the instruments that they're using to communicate and empower society to appreciate the dangers of this is not adequate enough to bring sense and change the mindset of our people. So we're bound to see an increase, and unfortunately it will affect healthcare workers who are in the front line of this virus.
Okay, Dr. Groome, perhaps speak to us about hospitalizations. It seems as though it's a very different picture to what we saw in the second and third wave, with the younger population being hospitalized this time around. But are we seeing it a lot milder? Are people in need of oxygen and ventilators like we saw with the Delta variants?
Good afternoon, everyone. Yeah, so I think as Prof. Madhi had alluded to, I think we did expect to see another resurgence, particularly of infections. But I think, and we have seen a marked and very rapid increase in infections in the past weeks. But, you know, hospitalizations do take 2 to 3 weeks, to manifest after the increase in the number of cases. But the early data that we have is really showing that this does seem to be a milder picture. So we have those that are hospitalized are less likely to be admitted into the ICU or to require oxygen. We have seen the shift towards the lower population, which would also be expected. I think one thing is also just that this tends to be a population that is more mobile at this stage. This wave this resurgence has coincided with, the matriculants leaving and varsity students being on holiday. And also this is the population that is less vaccinated. So we have managed to vaccinate a majority of our older population, and yet vaccine uptake has not yet reached high coverage in our younger population. So there is this trend towards increased admissions in the younger population, but this is also the population with milder disease. And the initial signal that we saw, I think there was some concern last week in terms of increased hospitalizations in those under 5, but from what we've seen is that proportion has decreased, and a lot of that may have been coincidental, finding of COVID-19 on testing, as well as maybe just cautionary on the sides of pediatricians. Most of those have been mild and admissions of shorter duration. And in general, we've seen thus far the duration of hospitalization has been shorter than in the previous waves.
I think it's a very different picture to what we saw in the second and third wave. Professor Madhi, maybe we can get insights from you as to what this actually tells us about Omicron. We do know it's highly transmissible. Yesterday, the Department of Health in its health briefing saying that what they have been able to pick up with Omicron is that there's a possibility of reinfection. So if you had Beta or Delta, you could possibly be reinfected with Omicron. What does this tell us about looking at how hospitalization isn't so serious, but there is a possibility of reinfection?
So what we know about Omicron over the past few days is that this virus is very much antibody evasive, irrespective of whether you've been infected by previous variants or you've been vaccinated. Compared to the Beta variant, as an example, this Omicron is about 5 times more resistant to antibody activity of vaccines than the Beta variant was. So what we can expect for to happen is large number of breakthrough infections. But what we're also seeing, like has been mentioned, is that the number of people that have been hospitalized has remained extremely low. Now, the reason for that is that both past infections as well as vaccines induce another arm of the immune system, which is known as T-cell immunity. And you have these natural killer cells, which destroy cells that are already infected with the virus. Now, this T-cell immunity is relatively conserved despite the mutations that has occurred in Omicron. And what we've come to understand of most of the vaccine work is that the T-cell immunity is really what is required to protect against severe disease and death. So in South Africa, we've just completed the Sero survey where we test for evidence of antibody against the virus, irrespective of whether people have been previously infected or not. And we completed the Sero survey in Gauteng. And some of those might be testing positive because of vaccine. What we've demonstrated is that 73% of people in Gauteng have got some immunity against the SARS-CoV-2 virus, and they would have this underlying T-cell immunity. So because this T-cell immunity's activity is relatively unaffected due to the Omicron mutations, what we're finding is this disconnect between people having breakthrough infections, having reinfections, but those not translating or rather progressing into severe disease. And that's really because of the underpinning T-cell immunity that is probably prevalent across Gauteng and as well as in many other provinces.
Sure, and then Zola, speak to us about reinfection. I'm going to ask you two questions in one because we don't have much time. But speak to us about reinfection. We're hearing now that you could possibly be reinfected even if you've had the two previous variants. What is it looking like with your members? Are they getting reinfected? And what is your stance on mandatory vaccines? Because we are hearing from health experts and scientists that there is some kind of protection against severe infection if you've been vaccinated. Do you agree with mandatory vaccines? And are you seeing your members being reinfected during this fourth wave?
Firstly, we encourage everyone else to consider vaccination. That's our position. But also we got to learn in terms of, we have heard many scientists and doctors having said that there's a significant number of vaccinated people. But let's quantify that, particularly those who have received the Pfizer. Most of them, they've taken one jab instead of two. So some of the numbers that are counted on the vaccination would not necessarily be reflective of the reality on the ground. And therefore, if you learn from what is happening in Israel, you realize that those are subjected to be reinfected or to be vulnerable to the vaccine because they've not completed the vaccination in totality. And hence, there are discussion of the boosters, both in Johnson & Johnson and the Pfizer. But as it relates to the mandatory vaccination, we are a constitutional democracy in South Africa, and therefore we can't force people who must win them over. But also let's take into account that there might be different reasons for other people not having taken the vaccine, not because they are naive or they want to create a particular narrative, but because of the condition under which their health conditions are, they are protected by the law. So the point is that we need to put efforts, all of us, not to make this problem a problem of government, but all of us as civil society to persuade people as much as we can, because anything that is enforced is bound to meet with resistance. So that's an issue. So we can't be discriminating people, and the rights of the people should not be ignored as a result of this. But because COVID is a world matter, and therefore it requires all our efforts and all of us to come together to persuade each other and to take each other along so that we become a society that is safe.
Professor Madhi, I see you shaking your head, and I would really like to get some insights as to why. I mean, this is the second time you're shaking your head.
Yeah, I can't believe that we're talking about rights of individuals when we've seen what COVID-19 has done to the economy of this country, when we've seen what COVID-19 has done to the livelihoods of people. We are destroying this country by maintaining the rights of an individual over and above the rights of the rest of the country and the rest of the citizens of this country that are doing the responsible thing to be vaccinated. Vaccines might not protect against infection, but it protects against severe disease. When we have overwhelming of our healthcare services, largely because of unvaccinated people, then the country goes into higher levels of restriction. That causes economic chaos. And the very unions that are talking against mandatory vaccination are the ones that will be screaming about unemployment. So I find it absolutely amazing and mind-boggling that we're talking about the rights of an individual when the entire country is being destroyed because of the type of restrictions that needing to be imposed because of us having large number of hospitalizations.
Your response to that, Zola?
But Doc, as a dog, you might be knowing that not every human being is entitled to that. There are different forms of diseases that people are going to, and such a vaccination must be sensitive to them. So you can't force them to do so. And you can't do away with the Constitution because the Constitution actually, its essence. No, Doc. The Constitution exists to protect everyone in society. And therefore, if we want to do that, we then have to take along everyone else, not in the form of enforcing people.
Okay, and Michelle, let's just speak about the death rates being quite low, and maybe also get your stance on vaccinations and how much they've been helping with regards to severe infection this time around. You know, many asking the question, why is it so different during the fourth wave? Why are the numbers so high but the deaths are so low? And we need to just try and explain to South Africans why this is the case. This time around during the fourth wave, wave, we have vaccinated a lot more. So the death rate is less than what we saw during the second and third wave, and it's a milder infection this time around. I want you to zoom in on the death rate being so low.
Sure. So I think once again, I mean, we've seen these very rapid increases in the last 2 weeks, and we know that deaths do take a little bit longer to accumulate. But I think definitely the early data is showing that the death rates haven't really picked up to the same extent to what we saw in previous waves. And I think this is what we're expecting. It's what's been seen in other countries that are highly vaccinated. Most recently, I mean, the UK had a massive resurgence in infections, and yet their death rate has really remained very low. And so we would expect increased infections. I think we're at a very different point, coming into the fourth wave, then we were at the third wave there. I think we only had, our healthcare workers vaccinated. We didn't have a large proportion of the rest of the population vaccinated. Provinces like Gauteng, we had a very large third wave, which exposed a lot of people to natural infection, and our seroprevalence, as Prof. Madhi had said, is very high. And so really, in terms of all previous experiences with vaccines and with other diseases, the vaccines prevent against severe disease. Prior infection will prevent against severe disease. And so we would expect these death rates to be lower. Obviously, we will still need to just continue monitoring in terms of the coming weeks. And I think while the absolute numbers are quite, concerning, I think we really need to recognize that the reasons people test are also very different. And so the infections that we're seeing may well be asymptomatic infections. They may be very mild infections. Often people, exposed to someone who is positive, and they will test even if they don't have symptoms. And so sometimes, the case numbers aren't necessarily a reflection of the more severe disease. And so hospitalizations and deaths are a much better metric to measure. And I think we really need to be starting to get back other diseases are really suffering in terms of the resources that we've put into COVID. And I think as a society, we will see this is probably not going to be the last resurgence or the last variant that we see. And increased infections is fine. I think we're really wanting to prevent the severe the hospitalizations and deaths.
Okay. Professor Madhi, you have tweeted quite an extensive thread where you explain and reflecting on Omicron so far, especially in Gauteng. I want to ask you about the issue around booster shots, the third Pfizer shots, and how you think that this is an unfortunate delay of the rollout of a booster shot. Why do you think that is? And many are expecting the NCCC to meet next week and to discuss maybe increasing restrictions. What do you think this will look like, but also why do you think that it's taken so long for them to roll out a third booster shot, in your opinion?
So the only reason we should go to higher levels of restrictions if healthcare facilities are coming under threat, and not because the number of cases and the number of people with sniffles is increasing. That's not the reason to go to higher levels of restriction. When it comes to the Pfizer boost, the Pfizer approval from SAPRA is for the boost only to be given 6 months after the second dose. But that's no excuse for us not boosting, especially high-risk individuals, people above the age of 65 and immunocompromised people immediately, and especially if they received a vaccine 3 to 4 months ago, the second dose. And the reason for that is based on the evidence, which shows that in those high-risk groups, even though they still remain protected against severe disease 3 to 4 months after having received 2 doses, you can increase that protection by giving a booster dose. So we cannot afford to wait after this wave has passed, when we start dishing out booster doses to those groups of individuals. In addition to which, I need to make it clear, the Johnson & Johnson vaccine is not a single-dose vaccine. That is not complete vaccination. Anyone that has received a Johnson & Johnson vaccine should immediately be offered a second dose of the Johnson & Johnson vaccine or the Pfizer vaccine, because a single dose of the Johnson & Johnson vaccine is far inferior compared to 2 doses of the Pfizer vaccine or even the AstraZeneca vaccine when it comes to protecting against severe disease.
Zola, let's just get your last remarks as we wrap up. Will you be pushing government to, I know that healthcare workers are getting a second Johnson & Johnson shot, but many are feeling a little bit uneasy around this. Are you going to push government in any way to vaccinate further? And what is your stance going to be should government recommend mandatory vaccines?
Our approach is two-pronged. Firstly, as a union, we are taking our responsibility to ensure that we encourage our members to go for the booster and be vaccinated, all of them. And those who have vaccinated one jab of Pfizer to complete that. That's our first responsibility. But equally, we want to mobilize not only government, every component of society, including a professor and the doctor here, present here, to venture into a joint program that encourages in a massive way South Africans to consider vaccination, because that's the only way to protect us from hospitalization and death. And we need to not to make this a government issue, it must be a societal issue. That's the point that we're making, and we have been making some proposals to government, as we had warned government on the complacent syndrome, that we should not lower our guards. We must continue to improve following the scientific evidence that will live with this virus for a long time now. So that's the point that we're making. We'll do everything in our power, including using our resources, to protect and defend this society.
Great. Okay, and then just lastly, Dr. Michelle, speak to us about the overall picture of Omicron, not just in Gauteng, where we see it being the epicenter, but that South Africans shouldn't let their guards down. And because we don't know much about Omicron, there is still some reason to be a little worried because of how highly transmissible it is.
Yeah, so I think we've still got a lot to learn. I mean, it was only discovered very recently. I think initial, studies that are coming out does point to increased transmissibility and increased risk of reinfections. But I think from the early data in terms of the immune escape, it hasn't been as bad as we initially thought, based on the number of mutations that are present in the Omicron variant. And so while there is increased immune escape compared to the other variants, this is not complete. And just to remember that this is only looking at antibodies, which is one aspect of our immunity. And we've got the cellular immunity, which are our T cells. So I think at the moment, look, cases still are increasing in some of the provinces. I think it is the festive season. And from a public health point of view, we've dealt with other infectious diseases in the past. We know now what is working for COVID. Definitely vaccination is going to be the long-term goal in terms of finally bringing this pandemic under control. But I think, as my colleague has said, it's up to everyone individually as well to be able to encourage those around you to vaccinate and to be sensible in terms of this time. We know that it's transmissible in terms of large gatherings when people are together. And really just to limit that spread, to continue with, we know that wearing of masks is beneficial, as well as keeping social distancing and limiting the number of gatherings. And really, driving the vaccination. And I agree, we need to really provide good information to those that are still skeptical. And I think it really is up to each and every one in society to be able to bring this pandemic under control.
Great. Thank you all three so much for your time. We do appreciate it. That's Professor Shabir Madhi from Wits University, Nehawu Zola, as well as the NICD's Dr. Michelle. Very robust conversations there, but this is bound to happen, especially around the conversation of mandatory vaccines. Of course, the President has set up a task team, and we still await on a decision around that.